it's my pleasure to introduce Dr. Catherine Trask. She is alumna of the program with a focus on physical hazards and risk factors for musculoskeletal disorders. She spent the last decade at the Canadian Centre for Health and Safety in Agriculture at the University of Saskatchewan and Saskatoon, and her roles there as a professor and Canada Research Chair in Ergonomics and Musculoskeletal Health. She was the founding director of the center's Ergonomics laboratory, leading an interdisciplinary research program focused on ergonomics in agriculture and other heavy industries. After a summer move, she is now working at the Ergonomics department of the KTH Royal Institute for Technology in Stockholm, Sweden. Her current research projects seek to combine the user-centered design approach central to ergonomics, the hierarchy of control paradigm central to industrial hygiene, and the community-engaged research strategies from public health. We were just chatting about the fact that she has to relearn Swedish to do her new job. So welcome, Catherine. Great to have you with us. Go ahead and unmute.
Thanks so much. Thanks, Sarah, for the introduction. So today, because I'm so newly arrived in Sweden, I don't have many Swedish projects that are at a stage that I could talk about. So I'll be talking about some of the work that I have done with colleagues at the University of Saskatchewan. So taking a pastoral view into agriculture today. So I think that ergonomics might be perhaps a minor part of the work done at UBC these days. So I thought it's probably fair to start out with a little introduction to ergonomics. This is the definition given by the International Ergonomics Association, and probably you can read this faster than I can read it out loud to you. But basically, ergonomics takes a systems approach. It's an applied science, and it combines well-being and overall system performance. So it's not only about health, it's also about productivity. And if we were to look at this schematically, we could think of driving overall system performance, this being kind of a happy marriage between human well-being, or the health aspect, and the productivity aspect. Ergonomics is not just chairs, it's not just offices and desk setups. We can think about prevention of musculoskeletal risk factors and human factors in ergonomic design in all types of work settings. So everything from baggage handling to different types of agriculture, crop production in the field, and also animal agriculture, which we'll talk about today, specifically veterinarians. So starting out with a question here: who gets work-related musculoskeletal disorders? And I've got this is not a poll question, but something to sort of think about if you were to guess whether Saskatchewan farmers versus veterinarians, to think about who would have, who you would expect to have the higher rates of musculoskeletal symptoms of a degree or a severity that's enough to inhibit their work or their productivity. We might sort of carry some of our stereotypes about what these workers are like, and maybe their education or their background. So think about veterinarians as perhaps being more white collar kind of workers with a decade or more of university behind them. But musculoskeletal symptoms are actually higher among veterinarians than they are among farmers, even in the same community. And when we look at shoulder pain specifically, looking at mixed occupations and then compare that to mixed veterinarians, large and small animals, veterinarians have much higher rates of shoulder pain. So we know that vets are some of the ones getting work-related disorders. And when we talk about large animal veterinarians, so those that are working especially with farm animals, food animals, cattle, beef, dairy. We see a lot of neck pain and a lot of shoulder pain, and this is fairly well documented in all types of high-income countries where large animal veterinary work takes place. So there's been some thought and some kind of theorizing for why the musculoskeletal disorder rates are so high among veterinarians. So, and one of the causes that we see a lot written up in literature, and then also in talking to veterinarians, is related to a specific task, and it's the one that we see over here on the right. Bovine reproductive exam, sometimes abbreviated BRE, or pregnancy checks. This is a repetitive task. It's something that veterinarians would do a lot, often for a whole herd of animals on a farm. And there's, as you can intuit from the picture, definitely potential for very awkward postures of the upper limb, and also exposure to high force. So I'll talk a little bit more about this task. This image comes from a veterinary manual, and it shows a bovine reproductive exam, also called rectal exam or preg check. So the vet reaches in with their arm in through the rectum of a cow so that they can feel the adjacent reproductive structures. And so what they're feeling for, this shows kind of the side view. Here we have a couple of alternate views showing the position and the movement of the hands. So what they're trying to do after they get into the rectum is to lift up on the reproductive structures and to feel for, basically to feel for a pregnancy. And that can be, you can look at that a couple of different ways. So yes, no pregnancy, and that's important, especially for beef cattle. For dairy, it's more important also to, well, in both, it's important to also figure out how far along the pregnancy is. So when will the cow calve? And that's important in dairy because you want to know when the milk will be available. We can see from these pictures that there are some quite awkward positions of the hands and a lot of grasping of slippery structures with the fingers in order to palpate the reproductive structures. This is also a task that has some force involved. So we can see really leaning into, it's not an easy entry into a cow rectum. And the smaller the veterinarian is, the farther they will have to reach, and the more awkwardly they might have to bend their spine, their neck, and sort of twist around in order to be able to reach in and palpate the parts that they're trying to get at. The notion that smaller vets have to reach farther is important because we are currently undergoing a demographic shift among veterinarians overall and also large animal veterinarians. So where once this was a very male-dominated profession, there has now been a shift to new classes of veterinarians being quite female-dominated. So I believe the 2018 intake at the University of Saskatchewan in veterinary medicine was 90% women. So women being a little bit shorter on average having lower strength capacity, and also having, in general, in many occupations, higher rates of musculoskeletal disorders. This is a concern, something to think about as the population of vets change over time. Often bovine reproductive exams are done manually, but they can also be done with an ultrasound assist, either holding a handheld wand and reaching into the cow with that, either with kind of loops or like a heads up display showing the ultrasound image, or with an external screen showing the ultrasound image. Folks can reach in to the cow with the ultrasound wand, or there can be wand extenders, which we see on the right. So kind of a long probe, so that the arm doesn't always need to go into the cow. So here we come to our first polling question. Which arm do you think vets should use for exams? The dominant arm, the non-dominant arm, alternate dominant and non-dominant, or should they just start working with cats?
I want to throw in my vote for cats.
Yeah.
Unfortunately, hosts can't vote, but I just putting that out there.
Okay. Well, there's if you're working with cats or ferrets, guaranteed you're not going to have to do this type of exam where you put your whole limb inside of them. So
just give it a few more seconds. We're almost got a couple more answers trickling in, and I will end this and share the results so everybody can see them.
Mm-hmm. So it looks like most
might have to close that window in your screen. I'm not sure.
Okay, I can do that. So it looks like most folks said to alternate. It seems like there is, if we think of job rotation as being a common solution, then that is one of the things we could look at here. What is often advised right now in veterinary school is to use your non-dominant arm. So if you're right-handed, use your left hand to palpate. And the reason given for this is very fatalistic. It's because it is fully expected that large animal vets will lose some sensation and function in the limb they use for examining. And this way you'd still be able to sign prescriptions with your dominant hand. So not a very hopeful view on the current prevention practices. So it had a bit of an introduction to large animal veterinary casts, and specifically reproductive exams for cows. The ErgoVet project was one we conducted at the University of Saskatchewan, and had a couple of objectives that we wanted to address with a survey. And then following the survey, we went out into the field and did some field assessments. So I'll talk through some of those. We'll start with the survey. And at this point, I'd like to acknowledge and also thank the research team. So my colleagues and faculty members, Chris Clark, Murray Jelinski, and Nathan Erickson from the Western College of Veterinary Medicine, and Brenna Bath from the School of Rehabilitation Science. Also had a couple of master's students working on this project. Xiaoqi Zheng and Robin Reist were also working on this project. So we did a cross-sectional survey where we invited every member of the Western Canadian Association of Bovine Practitioners. So this is an association specifically for vets that work with large animals and cattle in particular. Well, it was a cross-sectional survey. People could respond either to a paper version, which we mailed out, or they could use a web link. We had a response rate of 51%, which might not seem super impressive, but in general, response rates from working clinicians tend to be fairly dismal. So we actually were pretty happy with this. One of the questions that or one of the survey items was based on the standardized Nordic questionnaire for musculoskeletal symptoms. So we went through all the parts of the body and asked about whether they had these symptoms in the last 12 months and whether the symptoms were severe enough to impact their work. I'm going to go through some of the descriptives pretty quickly. Feel free to ask me questions later. And then come to the results for both symptoms, musculoskeletal symptoms, and the impact that folks described. So musculoskeletal symptoms of any body part, any type of musculoskeletal symptoms, we found a lifetime prevalence of 97%, so super high in this group, and a 12-month prevalence of 90%. So in any given year, very large proportion of these folks are having musculoskeletal pain. And when it comes to symptoms that are impacting work, about a quarter of folks are prevented from doing work as a result. This chart shows us the rates of symptoms by body part. The lower back pain rates are here similar to what we would see in a group of Saskatchewan farmers who do heavy physical work as part of their jobs. What is interesting is that the rates of shoulder symptoms are really, really high. And it is unusual for rates of shoulder pain to be higher than for lower back pain. In almost every occupational group, back pain is the most common body site for musculoskeletal symptoms. So this was definitely of interest for that to be so high, and it confirms what the literature says, and certainly what the vets were telling us anecdotally. There were a few open-ended questions on the survey, and we looked at these in a few different ways. We wanted to ask about how musculoskeletal symptoms had impacted their working life or their productivity, and did a qualitative content analysis on this. What we also got from these open-ended responses is that it's not just workload or it's not just exams that are a problem. So vets do a lot of driving out to the farms. That's because they're doing literally working in the field. They can spend quite a lot of time with static seating and vibration. So we know that that's risk factor. Another one that was interesting that came up is the demands of large animal veterinary practice it is emotionally demanding work, and there is research demonstrating that psychosocial risk factors and mood and affect also affect reporting of musculoskeletal symptoms, and also return to work kind of outcomes. So this aspect of healing and rehabilitation. So interesting that the vets brought those up themselves. When we asked folks about the impact that the impact that pain had on them, we saw kind of it's a cross-sectional survey, but we did see in the descriptions kind of a movement from mild to more severe. So from a mild perspective, I've had to cut back. Now I work mostly with small animals, so that is switching to cats. To the point where folks are seeing big impacts in their quality of life. I can't lift my right arm. I feel concerned for my general health and longevity. And finally, folks having symptoms to such a degree that they leave clinical practice, or they leave bovine practice. So that is a quick descriptive summary of what we found in the survey. We also did an analysis to look at what some of the risk factors might be associated with symptom reporting. So here we can go to the second polling question. What do you think are the most important risk factors for upper limb disorders among vets? So some of these are work related, some of them are, personal factors.
Gonna try to wait till we get to 30 respondents.
Looks like we have a clear front
Yep.
runner here.
I'm gonna end it.
Yeah, so it looks like most folks are guessing workload measures, and certainly coming into the beginning of this research project and our discussion with vets, we were hearing over and over, oh, these exams are terrible. This is definitely what the problem is. And intuitively, it seems like there's strong links between what we know to be ergonomic risk factors and the symptom reporting. We did multiple logistic regression with these different types of risk factors. Work factors including the total number of exams, the number of manual exams versus using that wand extender, whether folks were palpating with their dominant or non-dominant hand. We asked about work organization. So here we were asking about what is your practice type? Are you only a large animal vet or do you have a mixed practice? And the number of vets or the number of partners in your practice. So are there lots of vets working out the same clinic? And then some personal factors. And our outcome here was any upper limb, so this is neck, shoulder, upper back, elbow, wrist, symptoms in the last 12 months that were bad enough to have prevented work. Much to our surprise, we did not find workload factors significant here after developing the model. So what we did find was that practice type, having a mixed practice type, had a higher risk for these upper limb symptoms. Being taller was protective, and having more veterinary colleagues is, so having more people in your practice was also associated with higher symptom reporting. So there are some limitations with this, but it looks like the shorter vets, the mixed animal vets, and those with the larger more partners had higher risk of pain. We think that the work organization might be actually related to the fact that this is a cross-sectional survey. So I think we do have a temporality problem here. It might be that folks that have symptoms, we are capturing some of these folks that are seeing more cats and dogs and cutting down some of the cattle workload. Same with finding other, having more partners. This is a little counterintuitive. It seems like having more partners could maybe allow for sharing the workload, but there's a tricky overlap with sex and gender here as well. Women are more likely to have mixed practice and also more likely to have partners or more partners in their veterinary practice. We did not include sex in the model because it was highly correlated with height. And we approach this with more of a biological lens rather than a gender lens, but it's worth also considering that some of these work practices or work preferences that we see more among women veterinarians, so having a mixed practice and having a larger practice, and the fact that they're also likely to be shorter, we see that the types of risk factors associated with increased upper limb disorders describe the growing portion of the population of vets. A little surprising that we didn't see workload as an issue. So we wondered if there was something maybe we didn't measure that we should be measuring. And so we thought going out into the field and doing some like on-site ergonomic assessments might give us the opportunity to find out what we're missing. So this was a fairly small scale exploratory study. Before this, we couldn't find any examples of studies done out in the field with practicing bovine vets. So we were able to recruit 7 bovine vets during the autumn season for reproductive exams. So this is after the cows kind of come in from pasture and they have sort of had their breeding season out there, and then they are brought, for beef cows, they are brought in. If they are pregnant, keep them, and if they are not pregnant, they often go to market. Dairy doesn't have that kind of seasonality to it. Dairy cattle can be preg checked at any time of year because, of course, cows are calving and producing milk at all times of year. For each of the 7 vets, we did 2 visits each, a mixture of beef and dairy, depending on what they had scheduled. Had quite an age range with this group. 2 women and 5 men were included in the sample. There is here, as in the survey, the older vets tended to be male and the younger vets were women. So when we were out in the field, we brought video cameras with us and a measuring tape and documented the height of vet's shoulder. And then also not every single cow butt in the field, but kind of a sample of cow butts as they came through. This varies with breed of cow and age of cow and heifers versus cow. And of course, all cows going through the chute were female for the preg checks. In addition, we tested veterinarian estimated force required to enter the cow or kind of start the rectal exam. So this was done with a force matching protocol. I didn't want any of the force gauges that we had going inside a cow, and no one wants to lose one inside a cow. So we took a different approach. After the exams were completed, we marked any kind of vertical structure, a wall or a post, with the close to the average or the median cow butt height for that day. And then we had the vets use a digital force gauge to press on at that height. And then they did several repeats of this. And this is a force matching protocol. So we said, you've just done this task multiple times. Have a go at estimating or recreating that force pushing on this gauge. So they didn't see there wasn't feedback to them on how many newtons of force it was. They were just asked to do this several times, and then we took an average of those measures. While we were out in the field, we also documented the chute type. So this is the structure that guides and contains the animals. So we could say, cattle containment facilities. And then we also did video recording, and this is so that we could use the playback later to look at upper arm posture. So how elevated is the upper arm at the shoulder, and that's specifically because there are existing guidelines and kind of thresholds for increased risk. So a common one would be 60 degrees of arm inclination at the shoulder. If you are, if the upper arm is has more than 60 degrees, we would definitely identify that as awkward and problematic. We did some kind of task cycle analysis. So how long does each exam take? What is the duty cycle? So how much rest is there in between? We did a assigned a cattle agitation score. So this is based on some of Temple Grandin's work on animal behavior for cattle. And also, since we were there, did some observation of some other potential environmental factors which could be a problem. So take a look at what some of the typical, this is actually one of the nicer versions of a beef containment facility or cattle containment facility. We have here the crush or the squeeze, which can press in on the animal and keep it from moving around too much. Well, maybe we could talk about this in order. So on the left-hand side of this picture, we have a cattle gate, which can be opened. Cow moves through, and then the door shuts behind the cow. There's a head gate over on the right side. So this kind of closes in on the neck of the cow so that they can't back up and they can't run forward. The squeeze that squeezes in on the sides of the cow, it's not always used. Sometimes it is, especially if the cow's moving around a lot. Takes longer to apply, so some folks prefer to go without. And there is this access gate, formerly called a man gate, but we'll call it the person access gate, where once the cattle gate is closed, the vet's access gate can open, and then they can move in and perform the exam. And so then they would move out, access gate would close, head gate would open, cow runs through, cattle gate opens, and then the next cow comes through. So when a team is working really quickly, this can go pretty fast. They can get a lot of cows done in an hour. That's in beef. And this is almost always an outdoor process on a beef farm. And these, at least on the Canadian Prairie, these facilities are owned by the farm. So I said, this is a really nice one. It's not rusty. It's in pretty good shape. It's not always the case. In dairy, less common to have the cows run through a chute or to come into a squeeze. They are more often using head gates. So this would be, all the cows would come up to, often there's feed in front, so they want to put their heads in and then would get either sort of restrained with a collar or a head gate, another kind of some bars on their neck, so they can't move side to side too much, and that they can't back up or move forward very much. Dairy cattle get handled a lot. Dairy cows in particular are milked twice a day, sometimes more, and so they are fairly used to people and human handling, so they don't, the thought is they don't require quite as much containment. So this is what a dairy facility might look like. The exam workload, pretty sobering. Depending on the size of the farm, depending on the size of the herd, a vet in our study might do 50 to 300 exams in a visit, and every single vet in our study met us at some point in the day, and also had other appointments during the day that we didn't see. So we didn't follow the vets for their full shift. There's also substantial driving for us coming out from the university, so they do a lot in a day. These numbers were just the amounts that we saw. So that translated to between 19 and 116 exams per hour. So at those type of exam rates, some of these exams are going by really fast. The time between exams, or the median rest time between exams over the full visit, between 6 and 50 seconds. And the with the force matching protocol, we found between 120 and 350 newtons of entry force. So that's how hard do they have to push to get into the cow. When we looked at posture, all veterinarians at every single appointment were observed with their arms elevated more than 60 degrees during the exams. So no matter how tall the vets were, no matter how high the cows were, they didn't always have elbow above shoulder, but they were always above 60. So they were definitely what we would consider from an ergonomics perspective to be exposure to risk factors there. I mentioned before that dairy cattle tend to be more docile than beef, and that was reflected also in an aggregate appointment level agitation score. Beef appointments were a lot more likely to have highly agitated cattle than dairy. So what this can translate into is the cows moving around more, or they can't really run forward and back, but they can shift forward and back. Occasionally they sort of drop their bum down because they, I suppose, empathetically, it's not a great time for the cows. So they're sometimes wiggling around and kind of, and that the level of agitation that we saw in the cows was a lot more in beef cattle. We also took a look for, or let's say had our eye out for other ergonomic hazards, not only in the bovine reproductive exams, but also in other tasks related to this. And particularly in the beef appointments where there were outdoor cattle squeezes and shoots, vets were very frequently doing other kinds of tasks other than just the exams. So especially when the cattle were more agitated, harder to handle, they're moving through the chute a little bit slower. The vets, knowing that they have other farms to visit that day, would try to help things along. So they would start contributing to cattle handling. Typically, that's more the role of the farm operator and farm hands and the folks that are working on that farm. It's not necessarily considered a vet responsibility, but lots of them pitched in on some of that. And then opening the cattle gates. And this is where having a rusty, kind of crummy old chute, reaching way up to pull down on a heavy rusty lever, and then doing that for 300 cows in a row. This is an additional load on the shoulders. So similarly, where there wasn't a cattle gate, sometimes the vets were handling a fence post, which was slid in to prevent the cows from backing up. So this could be done with maybe a lighter piece of PVC pipe, but it seemed universally it was great big wet heavy wooden fence posts that were being used for this. This was a pretty small study, and we weren't able to see everything. And there, in some ways, it would have been nice to be able to measure more directly the force and also the posture. There are lots of body-mounted sensors which might be used for this purpose. And I would happily borrow that equipment from anyone who's willing to have it go inside a cow. Despite our survey finding that the upper limb musculoskeletal disorders weren't associated with workload, our observation out in the field shows that the reproductive exams, these preg checks, definitely expose veterinarians to what are known occupational hazards. So the usual suspects of awkward posture, forceful exertions, very high repetition in some cases. And some of these exposures are from non-exam activities. So the exam needs to be done by a trained vet. Handling fence posts and cattle and the levers for the chutes would not have to be. Well, there's definitely variety between the appointments. All of the appointments demonstrated exposure to these risk factors. And even the lowest force matching protocol entry force, this sort of reproductive exam startup force, was above established guidelines or force limits for pushing. So we've looking at this out in the field, it looks like there are hazards definitely present in the workplace. As from an industrial hygiene perspective, we would say that the controls at the top of the hierarchy are the best ones, the most effective ones for us to implement. But sometimes there are obstacles to implementation. And in order to be effective, a control needs to be actually implemented and not just recommended. So I guess as our final polling question, which control do you think would be the most practical on, let's say, the Canadian beef farms, the ones that are out in the field that involve these cattle chutes?
Sorry, Catherine, I'm realizing I think I missed option E when I put the poll in, so people aren't having the opportunity to vote for that one. But I will end this and show the results.
Yeah, the switching to a urine test for pregnancy status is a really, it's very enticing. Because it's one of those ones that would reside at the top of the hierarchy. It's trickier than you might think to get the cow to pee on the most portable, like a pregnancy test stick. There are costs associated with that would actually be more than having the vet come in. And that type of test would not give information on how far along is the pregnancy. So there's a couple of reasons why that one's tricky. The purchase of a cattle squeeze with hydraulic controls, there are some farms that have actually implemented that one. It is it's costly, so you're likely to only see it at farms that have large herds and are big enough and that bring enough cows through to sort of justify the cost. Job rotation is a nice one. I mean, administrative controls aren't. It's not always where it's not where we start, but that one would be quick to implement. The tricky constraint here would be that there is a perception maybe that being out on the farm want to, especially for young vets, to sort of demonstrate that they can do the job. And looking at this through kind of a gender lens, you can see how younger vets, and in particular women vets who are coming into a previously male-dominated profession, may feel like they need to demonstrate that they can do all the tasks, and that they can help out and pitch in and be, kind of hang in with everyone else. And there may be some of those social pressures which, can take something that seems like it should be really easy to implement, and then make it a little trickier. Spreading out rectal exams over several months rather than several weeks. For dairy, this is actually already the case. For beef, it's trickier because the beef cycle in Canada is so seasonal. It's important that calves are born during a part of the year when they can survive, so that they're born in the warm part of the spring, so that it's no good to have calves born in the middle of January, which means that the cows are all getting pregnant close to the same time, and then the pregnancy checks happen at close to the same time. So yeah, there are tricky constraints with this. Teaching students or teaching student vets low impingement techniques is something that is starting to be done in vet schools. So moving beyond just, oh, well, don't use your dominant arm because you're sure to lose function in that arm. There is more kind of musculoskeletal self-care, let's say, and self-management of pain when it happens that is being taught to vets, or starting to be taught to vets, I should say. Interventions in this work setting, like in lots of other work settings, is kind of tricky. I think it's most of us, either ergonomists or hygienists or other kinds of occupational health and safety professionals, want to come in, and if there's a problem, I'll solve it, like to come in with that enthusiasm and to make recommendations that we think will be effective. Currently, training is probably the most common that's actually being used. That's doesn't fit either with the hierarchy of controls or this kind of the ergonomics perspective, where we want to fit the tools and the environment to the worker rather than asking the worker to change. And yet we still need to be realistic and practical and be able to apply interventions in a real world scenario. So it would be great if no chutes were ever kind of rusty and crummy, and if all of the cattle containment facilities were containing the cattle enough that the cows weren't moving and jostling around so much that rather than just being a cumulative load issue on the shoulder, there's actually this kind of acute traumatic injuries that happen from the cow suddenly dropping or suddenly moving to the side when the shoulder's in this extended position. In the United States, I understand that it is far more common for the vets to own the cattle containment equipment. And so their veterinary assistants would go out to a farm before an appointment, would set up all of the equipment, and then the vet would come in. All of the cows would be run through what is a very good chute and one that the vets themselves have control over, and then that would be packaged up and then brought to the next farm. So that's one potential approach. It would mean that the farmers don't need to invest in this type of equipment, and but it also, I guess, that type of setup is requires kind of a system-wide reinterpretation of whose roles or who has what responsibility when it comes to these roles in agriculture. So it's not a simple fix to introduce. And I think that brings me to the end of the slides that I have. Acknowledge again special thanks to the students who, Robin and Xiaoqi, who really did the bulk of the work tasks associated with this research. And also special thanks to the Western Canadian Association of Bovine Practitioners for their partnership on the study.